All right. Well, welcome. This is my first time doing this for community hospice in this setting. Um, Let me introduce myself. My name is Shelley Waters, and I have worked for community hospice for about 6 years now. I'm currently the triage nurse. So if anybody has a need or a question that's more nursing or about patient care, they would call our 24-hour line. And during the day, I'll answer the phone and give advice, what medications to use, or transfer them to whoever can solve their problem for them. I was out in the field doing patient care for the first 4 or 5 years. So that's what I've done. I've been a nurse for over 30 years. Love nursing, had lots of different experiences, done a lot of teaching. So I enjoy this, just Zoom is a little different. I'm not as comfortable with Zoom as teaching in front of people. So I have 6 kids, and they're all growing up and getting married and moving out. So that's great. And my hospice experience personally is both my mother-in-law and father-in-law passed away with the services of community hospice. One of them was before I worked here, and that kind of opened up my eyes to hospice. And then the other one was after I was employed here. So if you, Rita, if you want to unmute and talk and ask anything, please do anytime. It's I love to engage and so tell me a little bit about your role in the care you provide.
Hi, Shelley. I was a caregiver for my mom for on and off at differing levels for about 17 years until she passed away in 2017. So currently I'm a patient family advisor for Sutter Health, a volunteer, and we are a committee of volunteers who help sit on committees regarding to improve the patient family experience by providing the patient point of view.
Okay. Wonderful.
And Shelley, I was a caregiver for my husband for close to 20 years. He was a diabetic with many complications as a result. He passed away in 2012, so 10 years ago. And when I joined PFAC, Rita and I and one other person were part of the original group. We now have 5 members. We all were sort of asked to think about a passion project, and this was my passion project because of being a caregiver for so long and realizing the toll that it takes.
Yeah.
And so I wanted to provide some support. And so we partnered with Community Hospice, who have just been remarkable in providing support for the community. And although the meetings are not always, a large group, posting them online has proven to be a wonderful tool in getting this very important word out.
Yeah, because then people can watch at their convenience and when they feel not a lot of people are comfortable with Zoom.
Right.
You send them that link. Here's a link. So it's a great, YouTube is like amazing. So
we appreciate you very much. Thank you for doing this.
So a question I want to ask, and this is something how I wanted to kind of introduce the concept. I listened to podcasts. I love to walk early in the morning. I walk most mornings. And I listened to all different things. And I was listening to a podcast about caregiving and the effects that takes. And one of them said that they hated that word caregiver, that when they were addressed as a caregiver, they didn't like that. And I thought, oh, that's interesting that for some people that title just sits wrong with them. And not that it's a bad title, but just for some reason, they didn't feel like it represented who they were. So I don't know if that's something that some other people might feel as well is, don't refer to me as a caregiver. So maybe when we are talking to family members or people that are providing that care, we can ask, how do you want us to address you? Do you want us to address you as, well, as your spouse or your wife or your husband, or do you want us to address you as a caregiver?
So
Because
what was the reasoning behind, frankly, I've not heard that before personally.
Yeah.
I don't know, Rita, if you have, but what was the reasoning behind it? Why did they dislike the term?
I think it might have just been a personal, like I said, I don't think it represented everybody, just maybe her viewpoint. But I think it made it seem very clinical. And she's like, I'm more than a caregiver. I'm the spouse. And so I have assumed this role of caregiving, which maybe she didn't want. Maybe there was some internal conflict, like I don't want to be the caregiver, I want to be the spouse, and I've been put into this position. So just kind of it surprised me because I had not heard that before either. So I was like, before.
Yeah, Shelley, this is Rita. I think the caregiver title is probably an umbrella title because, as you know, and as we all know, as caregivers, we are many things. We are advocates, we are sons and daughters, spouse, etc. We can go on forever and define who we are. But I think caregiver is just an umbrella title. And I like what you said about first thing, tell us how you want to address you so that we can add that to the umbrella.
Right. And I think it is an umbrella. Obviously, it's an umbrella term because so many people can be a caregiver. Like you said, it could be brother, sister, spouse, grandchild, paid caregiver. Like there's all different caregivers. And I think for her, this person that was just, sharing her thoughts is that it felt like it didn't address maybe every aspect of how she was related, and it made it more clinical. I'm not sure. So just a thought. So let's move on to some of the, let's see. I think I need to close this window before it'll let me. Technical difficulties. Oh, there we go. Okay. I was pushing the next slide thing and it wasn't moving to the next slide. Okay. So what is a caregiver, right? And that's something we talked about. What is a caregiver? So just defining what that term means, because maybe for somebody who's coming in, it's a new term. What does that mean, caregiver? Just like we said, it is somebody who gives basic care to somebody who has a chronic condition. And it can be anybody. It can be brother, sister, spouse, child, parent. In fact, we've had interesting situations where a parent of not a pediatric, this is an adult child, is the caregiver. So when we talk about chronic medical conditions, that sounds, oh, what is that? And it's any long-term diagnosis, cancer, the effects of stroke, multiple sclerosis, arthritis, diabetes, Alzheimer's. I think you were mentioning, Teresa, that your spouse had diabetes and just all of the effects of long-term diabetes. Dementia, and some of these conditions are going to change the way that the relationship happens because of the caregiving, and most can, but they don't have to. So I know in our field, when families do come onto hospice care, we try to alleviate some of that caregiving burden by providing home health aides that come in and bathe the patient. So that way, whoever is the primary caregiver doesn't have to always be in that role. We know chronic conditions last for a long time, or they just don't ever go away. So what are some of the things that means? What is a caregiver doing? It can be anything from preparing food, bathing, dressing, medications, and usually, like we mentioned, a caregiver is somebody who's in the immediate family. That's pretty typical of what a caregiver is. Okay, so our goal is we want caregivers to have a good, well-rounded life, and that their sole focus is not just providing care. And I had a whiteboard behind me because I was hoping to get a little bit of interaction. And so I'm going to just scoot back for 1 second and draw a big circle. Hopefully you guys all can see it. And so my thought is our life, is like a circle. And if your wheel on your bike only has one spoke, it's going to not ride very well. This is going to get flattened out. This is going to extend. You are not going to have a very comfortable bike ride. So if the only spoke in my life is caregiving, and that is really it, that's my 24/7, I am going to be very out of balance. This circle is not going to happen. And so there are lots of other circles. And so some of them, what would you say? Would you want to add, Rita, something that you could add as another spoke to this circle?
Exercise.
Yeah, definitely. I'm just going to put EX, exercise, right? Okay. What's another spoke?
Friends.
Yes. Friends. How about another one?
A job.
Yeah, something. Yeah. So, and I mean, this can expand on and on and on. Some people might need have like a spiritual connection. They have some kind of a faith base that gives them, right? We can have diet. I mean, it just goes on and on. But the more spokes that you have, the more well-rounded that wheel becomes, that your life, and it's just much easier to move forward because that wheel is turning and functioning, and that bicycle is going to move. So
that's a great analogy. I really like that. It's very,
okay.
Very good.
And a lot of times we see that after the fact, when somebody is on our hospice services and they are so focused on providing this care, and all of these other spokes have been taken out, and they are just there 24/7 taking care of this loved one. The loved one passes, and they are just floundering.
Exactly.
They don't have anywhere else to go or any support, and their life loses focus. They're like, what's the purpose of my life? I have a good friend whose husband, she was a caretaker for a very long time for him. Right at the end, he did go on hospice services and passed. And so I'll go and visit her, and she's, very tearful and very appropriate. It's appropriate, but she says, I don't have a life anymore. He was my life. Yeah. I don't know what to do. And so we joined a book club, and she goes to book club with me, and, but just trying to reestablish some of those spokes. So if we can encourage our caregivers to don't let go of some of those spokes. You don't need 20 spokes, but you need more than one. Okay, so path to providing that well-being. Okay, we know it takes not only an emotional toll. We typically think of the emotional toll, but it is a physical toll as well. So we're going to talk about some of those things that can help. A lot of times they feel like I have to do it all, and they don't. So we want to focus on how you can care for yourself and keep healthy. All right. So eating healthy. I don't think we put that up there, but that's huge. Eating healthy is huge. Oftentimes, you're providing care for someone, and so you don't have time to fix food for yourself. We tend to just go through McDonald's or just eat something prepackaged, and because it's easier. But lots of options. Something I do is I don't have time in the morning to cook breakfast. So on Sundays, I do the catchphrase is meal prep. I don't know, we just called it leftovers in the good old days. But I make enough steel cut oats to last me all week. That way I don't have to think about it. Every morning I got my steel cut oats and I eat, and it just takes just as long to cook a small amount as it does to cook a large amount. Keeping healthy snacks around that are easy to digest or easy and are shelf stable, nuts, peanut butter, things like that. Sleeping. I think we're going to talk about sleeping more later on. Sleeping is huge. You become very dysfunctional when you lack sleep, to the point of hallucinations. Like you just can't function. Not everybody needs 8 hours of sleep. Some people can do on less sleep, but we all must sleep. And so if your caregiving is involved with somebody maybe up a lot during the evenings with dementia, you're going to need some support. And this is when you reach out to loved ones and say, I need somebody to come over and stay the night so I can get some sleep. The problem is it's hard to disengage. When you hear the rattling and the noise and the loved one getting up and then the other person, the loved one, then you're up. So you're like, oh. So sometimes a house swap, hey, you come stay with dad, I'm gonna go sleep at your house. That's usually the best option because otherwise you're up hearing the noise and it's very difficult. We want to avoid caffeine and energy drinks to combat being tired because it's just a Band-Aid. Not that caffeine's bad, but if that's your rescue boat, eventually that rescue boat's gonna sink. So, don't rely on those things. Sleep is essential. All right, exercise, and that is up there. So I'm a firm believer in exercise, do it every day. And being outside, there was a really interesting study on being outside and in nature, not necessarily out in the mountains, but just outside on a sidewalk underneath a tree canopy. In other words, by some trees. And they were saying it improved mood and serotonin levels for up to 48 hours, which is great. So just getting out, taking a walk outside, looking at the trees, noticing the plants and vegetation, and just a few deep breaths can really improve mood and reduce stress. So that's an important thing. Also, if you have an exercise buddy or somebody that you are reporting to, is a really great way to stay motivated, because it's really easy to say, oh, I don't feel like it today. He's having a bad day, or my mom's not doing well. I won't do it today. But if you have someone that you are walking with, every day at 10 o'clock, I meet my friend for a walk, that is very motivating. All right. So managing stress. These are all tools that manage stress. There is the Caregiver stress that you can read, but all of these things, exercise, sleep, those are ways to manage stress. Okay, this is a hard one, avoiding alcohol, tobacco, and drugs. We often joke, somebody will call our triage line and we'll say, oh, my loved one's really having a difficult time, and I'll advise some kind of a medication to take away the anxiety. And then they joke, oh, I need some of that too. And we joke, oh yeah, that's a dangerous path too. Much like the caffeine, it's a crutch, and eventually it will break and it's not sustainable. So avoid those things if those are coping mechanisms, because they are not good coping mechanisms. All right, if you are having emotional difficulties, and I shouldn't say if, I should say when, because there's no way to care for a loved one, watching them decline and seeing and all the stress that adds, and not have emotional difficulties. So please reach out to your doctor, a counselor, clergy, somebody that's trained to help you. Friends are great. Friends offer support. Support groups are wonderful, but somebody who's trained can actually help you find a path to improve the situation. Friends are a great shoulder to cry on, but sometimes we need a little bit more to help us through. All right. Okay, humor. So often we forget the benefits of humor. Thank heavens now we have Netflix and all these wonderful streaming things in our home, and we can turn on humor. It can be something short, a little YouTube clip of a funny thing. It can be a funny movie. Laughing, same thing. Just is this chemical chain reaction that improves your mood, improves your serotonin levels. All of these things just decrease stress. So laughter is great. And what's wonderful is maybe the person that you're caregiving for, let's say, has dementia. They're not going to get the jokes. Some of the things are not going to sit with them, and they're not going to be able to process. But what they will process is your laughter. And seeing you laugh will get them laughing. And so not only does it decrease your stress, it's going to help them as well. So please get that Netflix subscription, or get your grandkids and tell them to give you the password, log on and watch something funny with your loved one. All right, getting out and about. It's really nice if you have the support, and you should, to be able to go and have alone time away from the person, the caregiving, and that is not necessarily task oriented, right? So task oriented means I have to go to a doctor's appointment. So I need somebody to watch my loved one so I can go to a doctor's appointment. I need somebody to help with the caregiving so that I can go pick up their medications. That's task oriented, and that's great. It's a break, it gets you out, but you're still on that spoke. All of your activities are caregiving. So get out and about and do something, have an activity at least once a week that is not caregiving related. It's purely something, another spoke on that wheel. A book club, maybe it's a scripture study class, or maybe it's going to the mall to get, Bath and Body Works has their sale and you want to get some new smelly, lovely lotion, anything like that. So when we talked about earlier, it's not a if, it's more of a when emotional stress comes on with caregiving, depression follows. Sometimes depression has been defined as anger turned inwards. So maybe you're angry at this role that you've been given. Maybe you're angry at the person you're supposed to be providing care for, because now all of a sudden your relationship has changed. It's not the relationship you once had. It's this new relationship, and it's unequal the way you perceive it. So that can cause anger. So sometimes that turns inward and can turn into depression. It's very difficult to understand depression, but it is real, and you can definitely seek some medical treatment for that. All right, I love this line, taking care of business. Once again, there's that spoke, and money, even though that's not something, it is related to caregiving, but being able to be aware of your finances and what's going on with that, and not have that create more stress in your life is important. Make sure that you're aware of the finances, what's going on, especially if your loved one is incurring expenses that you aren't aware of. Maybe that is by purchasing things that you're not aware of, or maybe it's incurring debt that you're not aware of. So finances are important. Get some help. If you're of a generation that's not comfortable with going online and doing those things, get a generation that is. Get those nieces and nephews, grandkids to come over and help do it for you. That was something that I provided to my mother-in-law. She was not comfortable doing her finances online. She just didn't really know how to do that. And as she was looking, she knew her time was drawing close to the end. I stepped up and I was able to help get her finances in order, get everything online, make sure the bills were getting paid. And I know that was a big relief from her for her stress. All right. Okay, what about our own health as caregivers, right? Our health is important. We focus so much on the caregiving role in providing their needs and their health needs. Sometimes we neglect our own. So make sure you're getting your regular checkups. Even if you're not feeling sick, go in for those regular checkups, get your vaccinations, do those things that are important. Okay, and we did talk in there again, they talk about recognizing your limits, that you have limits, and you need to make sure that you know those limits so that you don't injure yourself, both physically or mentally. And there's lots of other things that are available, and hopefully through these supports like this Zoom meeting, there's things like adult daycare services. There are, Meals on Wheels, respite care, and eventually hospice care that we can come in and help provide some of that support. Okay, so some of the things we can do. This is more of like of a mental thing. We've talked about some of the physical things about sleeping, eating right, getting outside. But this is more, now we're gonna talk a little bit about the mental component. We wanna think positive. Positive thinking, we can think negative, and when those negative thoughts creep in, it starts to spiral. So we want to think positive and take every day, take a few moments to think some positive things that can happen today. And that can be away from the caregiving itself, or can be a part of the caregiving. Maybe it is, today we're going to have fun, and I'm going to paint mom's fingernails, and I'm going to paint mine, and it's going to be fun, and she's going to love it. That would be positive, rather than the negative of, I got to provide more caregiving, and she gets so frustrated when, so think of some positive things. Recognize your limits and make peace with those. It is okay to say, I cannot do this. This is something I just can't do. And maybe this other caregiver can do it, but I can't. And that's okay, because that's who I am. And these are the things I can do. So letting go of that guilt, that's huge. Realize, how often do we criticize what we have not done, right? We think, I didn't get the laundry done, or, I wasn't able to pick up those medications for that person, or, all of these things that didn't happen, or, right? That's what we focus on. Thinking positive is patting yourself on the back and saying, I did a good job today. I was able to get all of these things done. Not, I didn't get those things done. Look at all the things I did get done. Taking a break. If you're angry or feeling, be in tune with those feelings. Take a break. I am walking out for 5 minutes. I'm putting myself in timeout outside for 5 minutes and taking some deep breaths so I can stay more focused and more in control of my emotions. Also, not only stay connected with your emotions, stay connected with the outside world. Don't become isolated. Stay connected with your friends and family. Thank heavens we've got these lovely phones that we can, if loved ones are far away, we can hop on and FaceTime them and help them see, see what you're doing, how their loved one is doing, connecting with them and feeling like they're also a part and they can support you. Okay. All right. Here's some things to think about. We are not, most caregivers tend to be a little bit older. Hopefully we've got some young ones in there, but a lot of times we are the same generation. The person we are caring for generally is a loved one of the same generation. And so as their health declines, guess what? Our health is probably declining too. Our physical abilities are declining as well. Maybe obviously not to the same extent the other one is. So we need to be careful about our health, looking at some of the tasks that we are asked to do and thinking, okay, could this hurt? Am I going to get hurt doing this? This is when I know, well, as hospice, we come in and we have our nurses and our nurses' aides and our home health aides show people, this is how you can do this safely. This is how you can change a loved one when they've soiled themselves safely without hurting your back. So those are some tricks. If you don't have hospice or palliative care that can come into the home, YouTube it, how to, change a loved one that's bedbound. And I'm sure it's out there. If you are currently employed and trying to provide care, that is a very difficult balance. I love my job. I love it. I would not want to give my job up because it, like that spoke, it helps define me as another role. When I was doing caregiving for my mother-in-law in the final days of her life, my husband and I switched off. He would work and I would stay home, and then the next day I would work and he would stay home. We needed that. We needed that chance to get away and be defined in another role. So if that's not a possibility, one thing to do is maybe shorten your hours so that you're still able to have that income. and also being able to go out and define yourself in a different way. All right. Okay, so some of the things that put you at risk as a caregiver, because guess what? It can be risky, it can be difficult, and we know it's challenging. So caregivers are at a higher risk for alcohol, tobacco, and drug abuse, because like we mentioned, it's a crutch. It's a crutch to deal with the stress, but eventually it gives away. They are at a higher risk for anxiety disorders, cancer, diabetes, heart disease, high blood pressure, high cholesterol, heartburn, infection, obesity, and increased pain. These are all things that obviously are exacerbated under stressful situations, but they can also increase your likelihood of having them. So caregiving can be very stressful. The idea is to reduce that stress from the get-go. Make a plan as it begins, as this caregiving journey begins, to make sure that your needs as a caregiver are met so that these things don't happen. All right, here's some things to bring up to your physician, your loved one's physician, both. When should I consider long-term care for my loved one? This is a question we get often, is I can't do this anymore, but I feel guilty because I promised my loved one I would not put them in long-term care. We get it all the time. And the question we usually refer back to them is, all right, understand that question, understand that concern. If the roles were reversed, what would you want your loved one to do if you were the one with the chronic condition? And oftentimes they're like, oh yeah, I'd want them to put me in a facility so that they can come and visit me and not have to carry that heavy burden of caregiving all the time. So sometimes just reversing it helps. Another question is, where does caregiving shorten your lifespan? And it can. And we just saw on the prior slide that if it puts you at increased risk for these disease processes, all of those shorten your lifetime. Here's another one. What dietary items can you suggest for my loved one? I know something I suggest quite often to our patients, because swallowing can become difficult. So oftentimes they go to something pureed, which is generally applesauce and pudding. Both of those are very sweet and just not a wide flavor palette. So we start to be a little bit more creative. I always suggest mashed potatoes. Mashed potatoes are supposed to be pureed, right? Spaghetti is not supposed to be pureed, right? That's not something we normally eat pureed. So it might have a strange taste to them, or strange, but mashed potatoes are. Scrambled eggs. So those are things that you can bring up with your physician. What are some things with this person and their disease process that you might suggest dietary would be good? All right. Do you have any questions? I kind of went through that quite quickly. Any comments or questions?
Well, I think that was one of the best presentations I've seen, honestly, on caregiving. So you have nothing to fear with Zoom, because you did an absolutely great job.
Thank you.
I loved your analogy of the spokes and the wheel. And at the end of one of your slides, you said, keep living. I think as a caregiver, it's often hard to remember not only to think that, but what does living mean when you're a caregiver? It can become overwhelming and just be the day-to-day. I remember at one point literally having to take my husband to 2 or 3 doctor's appointments per week, every week. And it got to the point where I thought, I can't do this anymore. It's just the thought of another doctor's visit was overwhelming. And it was at that point that we decided to call and get some help coming in. We don't have family here, so we needed someone, to come in and help. and it made a huge difference. But for me, one of the overlying factors was guilt of, if when I left, not that my husband was demanding or at all, but still it was very hard to resolve that. But what I found out was when I did start to do something for myself, and it wasn't a doctor's appointment or something like you described, when I came back, it made me a better caregiver because I had taken the time to do something for myself. So I think you pointed out everything, and I really do appreciate it. Thank you so much.
You're welcome. One thing that wasn't on the slide, but is oftentimes, I mean, I joke about it, and it is a joke, is that I feel like the doctors have to make their Mercedes car payment. And I mean that as a joke, that some of these doctor's appointments are just not necessary, right? In other words, they say, okay, well, let's have you come back in 6 weeks and check in with you.
Mhm.
Okay, what exactly are we looking for when I come back in 6 weeks and you're going to check on me? Because I have my nephrologist is checking on me, my cardiologist is checking on me, my endocrinologist is checking on me.
Exactly.
Right?
Yeah.
How many check-ins do I need? So if you're just looking at my blood pressure, well, my nephrologist will know that. And if you're just looking at my labs, well, you've got that. So I think sometimes if we can say to our caregivers, verify how important this doctor's appointment is. Like, how can we skip this appointment? What are you looking for? Because if it's you're looking to see if their feet are swollen, well, I can call you and tell you, no, the feet aren't swelling. So do I really need to come to this appointment? Because that burden is huge.
Yeah.
Take loved one, getting them in the car, getting them dressed,
Exactly. Right.
getting them in the car, then waiting in the doctor's office for a half an hour. Now they have to go to the bathroom, getting them into the bathroom, and then waiting. It's a 3-hour ordeal.
Exactly.
Just
Yeah.
say, oh, you're great. We'll see you again in 6 weeks. Why am I doing this?
And I think in 10 years, the one, if there is anything good that's come out of COVID, is some of the virtual things that we can now do that we couldn't do before. So certainly that hopefully has changed some things for the better. But that's a good point. The problem that, when you're dealing with someone that has so many complex issues is the coordination between the doctors.
Right.
And that's another topic, but that's another project that we talked about pre-COVID, trying to coordinate for those patients in the hospital, is to get doctors to, sort of communicate better. But those are very good points. And again, I just really appreciate your messages today.
Okay, well, thank you. I enjoyed presenting, and so
Kelly, this is Rita.
yes.
I just wanted to echo the positive remarks that Teresa just made. I really appreciated the discussion format, so we could participate as well. And I really, one of the things that really hit me today was thank you for reminding me to focus on the positive things that I did today instead of all the things that I couldn't fit in. Because there are many days in my caregiving where I went home and said, oh, shoot, I forgot to do this or didn't have time or whatever. And once I realized that I needed to focus on what I did do, then it was a lot better. So thank you for reminding me about that.
Okay, great. All right. Well,
Shelley, sorry. Thank you so much. That was amazing. I was listening in as well. Did we have one more slide that tells us about our next Thursday?
Yes, I'm sorry. There's some, yes, I'm sorry. The questions, I knew that was towards the end. So here are some of the resources, and you can see that www.caregiver.org. And then the Women's Health has some great points on caregiving and stress. So there's that slide. I'll leave that up for a few seconds. Just some great resources. All right. And then this is our next meeting. It's going to be August 11th for talking about caregiving burnout. So hopefully you can join us for that. And that will be available also online afterwards. I think.
Perfect. Thank you so much, Shelley. And yep, Rita and Teresa, our wonderful marketing and public relations department should have this presentation up on the Community Hospice YouTube channel as well.
Thank you.
It should be accessible shortly.
We'll be promoting it. Thank you so much. Thank you both.
Everybody. Take care.
Thank you.